So perfect. We'll get the recording started. We'll get Jake got the slides up. Um, Thank you for the introduction, Ashley, and thank you to the University of Michigan Cardiovascular Institute for hosting us today. Yeah, as Ashley mentioned, Jake and I have been leading a few of these AI initiatives at Dime, and we're really excited to be sharing some of our findings and really talk with you all today. We wanted to start out with a quick survey for you all. We don't have a poll on Zoom, but if you'd like to respond in the chat, we very much welcome that. When you think about the use of AI in your day-to-day work, which of these feelings comes to mind first? So we'd love to hear from the audience, A, B, C, or D. And also just be thinking about this as we move through our presentation today. If there's anything that we're talking about that gives you one of these feelings, pop it in the chat or ask us a question about it, right? We want this to be as interactive and conversational as possible. Want to really be highlighting the resources that we created, but also how it, can impact and drive some change in the work that you do. So would love to hear from the audience in this, and please feel free to ask questions as we move through the presentation.
All right. If you just give me a few minutes, I'd love to introduce the Digital Medicine Society or DIME and kind of what we do before we pass it back to Ian and dig into the playbook. Just thank you again to University of Michigan, Frankel Cardiovascular Center. This is part of the innovation webinar series, and truly at Dime, digital innovation is helping to redefine healthcare. And you're going to hear that a lot throughout the presentation today, specifically AI in healthcare. And so just want to dig into our mission, our vision, and kind of where we're headed, and celebrate these first two resources that were released under our new kind of Healthcare 2030 umbrella. But who is Dime? We are a global nonprofit, 501(c)(3), and our superpower is convening, right? So we convene stakeholders to take action to fix problems in our complex field. We're not just kind of observing on the sidelines. We're really taking action here at the intersection of healthcare and technology. And our mission is to advance the safe, effective, and equitable use of digital approaches to redefine healthcare and improve lives, with our vision being better health powered by digital innovation. And so we've really been focused on this vision now and kind of building it and leaning into it these past few months. And that is kind of Healthcare 2030 by Dime, which is a blueprint to transform US healthcare in the digital era. And so if you scan the QR code here on the screen or the next slide, you'll come to the Dime website and you can review recordings from the Healthcare 2030 Summit that Dime hosted in DC in September. And those were some really candid, powerful panel discussions that I really encourage you to check out and join that conversation. And you can also review our impact thesis for the digital era of medicine as well. And just a little bit more about Healthcare 2030, because again, this is what over the next 5 years Dime is going to prioritize. And this is that umbrella where the Playbook and our Health AI education course series were released under those first resources. So over the next 5 years, Dime's going to prioritize prevention, so moving from sick care to health care, health outcomes, aligning incentives with better health, personalization, so that tailored care to the individual, and sustainability, delivering care that is viable. And we're going to do that by leveraging four technical drivers of transformation: data, compute, connectivity, and communication. And I hope that you hear those and see those woven throughout our webinar today from the playbook, from the education course series, because this is really where Dime sees the field going. And so, again, you can join that conversation, review the impact thesis in the recordings by scanning the QR code here in the presentation. But we've talked about the playbook a bit. Ian, I'm really looking forward to the preview today, hearing more about it. So back over to you, and we will dig in.
Yeah, let's dig in, Jake. Thank you so much. As Jake was mentioning, we started a lot of work, and as Ashley was speaking, we started this work over a year ago with some really exceptional project partners, Google for Health being our title sponsor on this project. So we've convened, as we do here at Dime, we convene lots of project partners throughout the industry in these pre-competitive collaborations and really lean on their expertise to help us create guidelines and best practices and learn from them all about how they're deploying and implementing AI. What are their lessons learned? What are their best practices, their barriers, the roadblocks that they've been encountering? And the playbook itself is a reflection of that. It's a real world practical guide that is meant to help guide you through, selecting and deploying the right AI tools. So I really like to just highlight this slide because we've had some exceptional partners, a lot, including the University of Michigan here and Ashley and Dr. Ganbari as part of the project. And so, always love the opportunity to shine a light on these partners and all of the impact that they have had in collaborating with us throughout this process. We'll go to the next slide, Jake. This is a very quick overview of what the playbook is. So this, as I mentioned, is a practical guide that helps health system leaders really plan, implement, and scale AI effectively, safely, and sustainably. You'll see in the middle, I've highlighted a few key resources. We are going to get a lot more in-depth than that today, but these are some of the highlights. And then on the right-hand side, you'll also see some of these fun AI-generated images. This is just a call out for me to mention that we have really three specific audiences that we wrote the playbook for. The first is these strategic leaders at the hospital systems, maybe the Dr. Gunbaris who we were working with, who are really in the nitty-gritty of the strategy and the decision making of what tools should we be bringing in, what does our finances look like, how is this all going to work. Then we focus on the clinical and the operational leaders, the people who are actually implementing these tools in the day-to-day work. So how can we support them and simplifying workflows and really focusing on the actual boots on the ground implementation. And then finally, the third bucket of the audience that we kind of have written this playbook for is that technical staff. So the data engineers, the data folks that have a lot of infrastructure questions and a lot of data access questions. So we have developed some resources specifically for those audiences as well. That is a quick overview slide. Jake, I am now going to steal the screen share and I will share my screen here with you all of the playbook, the interactive web resource that we've created. And why does it do that for me? Here we go. We can all see the screen, right? So we have created now, out of that year-long process, collaborating with partners, we've created this online resource of the playbook, implementing AI in healthcare. I'm going to take you all through a demo today. As I mentioned, please feel free to submit questions in the chat as I walk through this. Jake, I'll kind of lean on you to call any of those out. This is your guide to responsible AI implementation in healthcare. So we've really set this up, setting the stage here, saying, poorly chosen AI tools can drain budgets, they can stall workflows, they can damage trust, and with up to 70% of pilot failure stemming from people process issues rather than the technology itself. So really starting out this playbook, we frame the issue at hand on the people, the processes, the workflows behind the tools that really make the difference. You'll see on this home page of the playbook that we have broken the playbook down into three core sections. The first being identify the problem and assess your readiness. The second then being, okay, now we're ready to source and evaluate the tool that we have decided we need. And then third is, okay, we've chosen that tool. Now let's go and deploy that tool into our system. And so I will walk you through some resources and some narratives that we've developed and hopefully kind of tell you an interesting story here of how we're seeing AI being implemented today. So this first section, as I mentioned, is really about identifying the problem, assessing your readiness. We have a great pro tip here is what we call them. Your AI strategy is not just that shiny new technology. It isn't, hey, our neighbor down the street has implemented this scribe tool, so let's do it too because it looks cool, right? It's really about honing in on the problem at hand. And so we have set out this first section to really help our audience do specifically that. We've created a survey that health system leaders can send out to their staff and say, hey, what is the lay of the land right now? Are we using any AI tools in our workflows? How is that going? Are we, concerned about anything? Are we seeing impacts in positive ways or negative ways? So it's really a survey that has been built for these leaders to send out and get that lay of the land at their system. Actually, I think the University of Michigan sent this out, and we kind of have some interesting data points to actually share with you all later in this presentation. But that's really our starting point here is, survey your system, understand the lay of the land. Once you've done that, we'll move into defining the actual problem at hand. So you know what's going on in your system, you understand how people are using or not using that technology. Now let's start to understand the problems that we can address, the things that we want to change in our organization that might be ripe for AI. So this page is really meant to take you through some of that that exercise of how you define a problem that matters. So are we looking at concrete challenges like rising sepsis rates or mortality rates, things like that, rather than, hey, people seem kind of, burnt out and maybe there's a tool that can help with that, right? That's a poorly defined problem. So we're really here focusing on helping people define a very structured problem and understand specifically what they're trying to address with AI. We then have a really nice handy AI fit checklist. So you've defined that problem. Um, but is that problem really an AI problem? Or is it just a problem in general that could be solved with a different tool or an adjustment to a workflow? And so you can move through this kind of resource, interact with it, based on the problem that you've identified, and click through and get a little fit score for, hey, is AI maybe a fit for this problem at hand? So we still haven't even decided, until now, that AI is actually the tool that we're bringing in to the clinic. I like this. Also, we have some next steps. So once you've gone through that, define your problem, then we'll ask you to go through and start to explore our health AI maturity model. So we have developed a very comprehensive, very text-heavy page that I won't go too deep into today, but I invite you all to really explore this table that we've created. We have 7 different domains of topics from leadership and governance all the way to workforce development, stakeholder engagement, financial sustainability. Within those, there's some subdomains and subtopics. We have scored health systems on a scale of 1, which is very initial early maturity, to level 5, which is optimized. That level 5 is very much aspirational. We don't expect any hospital systems to be kind of at that level yet, but it's a nice kind of target or shining point for you as a health system to work towards. I wanted to give that quick voiceover to the maturity model because the key resource that we have developed for this first section is our readiness assessment. We really, if there's one thing that we want our users to be doing in here, is to come in and assess their readiness to implement AI in their system. So we've created this assessment that checks against that maturity model, essentially. We take you through each of those domains. Can answer some questions based on the benchmarks that we've developed with our project team. I'll just do this very quickly, but you'll see we're working through that technology and infrastructure, the workforce development, clinical integration, implementation, financial sustainability. So we'll just go through and click a few of these just for clicking's sake. And then you can get your results and you get a really nice comprehensive assessment snapshot sent back to you. So you can see based on these responses, we are a 3 out of 5 maturity score. That's emerging maturity. So we have emerging champions, we have pockets of activity, but our formal strategies and governance don't seem quite enterprise ready yet. So then you can see how, the heat map kind of breaks down per domain here, where you might have room to improve or where you might be very mature already. In this case, the leadership and governance seems pretty good, but maybe that data and infrastructure could be improved a little bit before we move up. This assessment also will show you where you answered those responses. And then I really like this responsive next step piece. So if you are a health system who has scored, a 1 out of 5, you're in that initial level of readiness, we will actually direct you back to the first section of this playbook and say, okay, let's get the lay of the land. Let's define the problems that matter and let's review that maturity model to really make sure that you understand where you're going. As you move up into maturity, we will start directing you to different resources. This one still directs you to the maturity model because we're kind of right in that sweet spot. We might also direct you to, okay, now you're ready to be selecting a tool. And so this personalized AI readiness report is really powerful, really encourage, our leaders to be using this and assessing their hospital systems, but it's a really interesting tool for you all as clinicians and just the day-to-day folks too on the ground to come in and do your own assessment. See, assess where you think your system's at and share that with leadership or share that with your colleagues to kind of start a conversation. We've certainly heard that from a lot of our partners already, that this is a powerful tool to do exactly that, to start that conversation and really start to have those conversations on where do we need to go? What's missing? How can we be really successful here? So we've gone through that readiness assessment. Maybe you are ready now to move on to choosing the right tool. We've defined the problem. We know what our system is expecting in terms of how to use or what they want to use these tools for. So now let's go into choosing the right tool. This section, again, is really focused on the people, the processes behind the technology. We have some great stats here. 80% of pilots fail beyond the pilot phase. Up to 70% of those failures are stemming from the people and the process issues themselves, not the technology. And the number one driver of clinician dissatisfaction with AI is the misalignment between the tool and the workflow. It's not that the tool doesn't work, it's that it doesn't work within their workflow. So we have created some resources here for our users to really scroll through and see, one, where is AI delivering value right now? Where is it actually making a difference? We can see a lot of cool, shiny technologies that, are plopped into a workflow or into a problem. But where is there actually value being created by these tools right now? So you can go through, review our stackable wins pyramid that really outlines here some of those low-hanging fruit as my screen loads. Some of the low-hanging, high-volume administrative tasks are very ripe, and that's what we're seeing right now, right, with the AI world is a lot of the mature deployments are around those administrative tasks. They're around the clinical and documentation workflow tasks. Those things that are happening very frequently throughout the day can really start to show a real, return on someone's investment using a tool like this. And so we start to break this down by these types of tasks and their frequency in which AI can deliver kind of impact. And so you'll see here the predictive and diagnostic tools, they're great, they work well, but they may not be as high volume, and it may be a little bit harder to demonstrate some of that return on investment and real impact of these tools as we move up the pyramid, at least in current day. We get into a little bit more where AI can deliver impact. And then, now okay, where is this problem sitting within our organization? What types of tools are available to us? Well, now let's get into procuring that tool, right? How are we going to get that tool into our system? Are we going to build it? Are we going to buy? Or are we going to partner with the vendor to develop something together that fits our unique needs? We're seeing a lot of that right now is a lot of collaboration between vendors and health systems to kind of collaborate and localize these solutions to their unique needs. We walk users through, just a basic table of information here of what to consider when you're going through that build, buy, or partner framework. We have some decision checkpoints and some more pro tips that you can pop up and really get an insight into how our partners have thought about procurement over the past year or so. The last section of this choosing the right tool then is really about, okay, we have now circled in on some tools that we want to evaluate, and this is how we will evaluate them. And so we have created a structured kind of health AI evaluation guide that, we hope our audience uses to really take a structured approach to assessing vendors or assessing tools on a standardized type of scale. And so this is a general framework, but it really walks you through some of these key domains that our partners have seen as very important in evaluating AI tools. We also have some spotlights here. So interspersed throughout the resource, there are lots of video content from partners talking about, hey, this is how we've done it in the past. These are the things that we're seeing make an impact. These are the lessons learned. This is a really, really great resource for exactly that, for seeing how real people are really doing this work. And we've tried to bring in as much of those videos as possible. One of them here being our colleague from Stanford University, Dan Char, talking through some things as well as partners from Vanderbilt and Texas Children. So lots of health systems and clinicians on the ground implementing these tools, seeing what's working and what's not working. Once you've gone through evaluating and kind of choosing that tool, of narrowing your shortlist to some finalists, we walk you through how to kind of still make that final decision of what tool do we want to bring in. We have some additional considerations that the Playbook team has created here. And then we'll move into how to deploy AI. So theoretically, we've chosen that tool that we want to bring into our system. And now the Playbook team has created a replicable 4-step framework for implementing AI in healthcare. Plan, deploy, monitor, and scale. Very simple, very high level, but we think it really does a nice job of just taking you through this process and understanding some of those high level pieces of information to be walking through. And so you'll see within this framework, we have in the plan foundation, we have a little table of contents. Every section will look very similar to this. You'll see straight up front what you need to do in the planning section for a successful implementation. Things like forming your implementation task force, convening a governance committee, validating the data and the workflow alignment, managing risk and setting your compliance standards. So a lot of that planning work up front, defining KPIs and measures of success. And again, we'll go through this and you'll see some interactive resources. You'll see great partner videos or videos from our partners explaining some key concepts, telling us how they've approached this in the past. Um, you can go into and see, I really like these examples about validating these tools. We have some great video content in here from Dr. Marla Sammer, a radiologist from Texas Children's and American College of Radiology, who really talks about the need to validate these tools locally because there's a lot, especially in pediatrics. She's a pediatrician, and sees that there's a lot of tools out there that have been developed with adult data for adult patients. And there's a real lack of, tools out there that have been validated for pediatrics. And so she kind of talks us through in this example some really interesting use cases where adult tools that are used for children because they need to be used for children are actually not meeting the mark and it's creating more risk and potentially harm to patients. And so we talk through here that need to really validate these tools on your population, understand how these tools will work within a pediatric population or within an aging population. So it's all about locally validating these tools. We'll quickly peruse through the rest of this framework, that being deploying. So you have planned your first deployment. Now you're ready to actually implement that, whether it's on a small pilot scale or at a system-wide, hey, we have an ambient scribe that we want everybody to start using. We'll walk you through how to deploy those with confidence. You can choose your rollout method. We have some key considerations about technical integration, stakeholder communication, training and education. And then we will move into our third section, which is really, really key here, which is monitor. So AI, as many of us will know, is not one of those set and forget tools. We see a lot of data drift with generative AI. We're seeing a lot of model drift, things like that, that these tools are changing over time. And so there's a real need for health systems to have very structured, standardized ways to track how these tools are being implemented, the outcomes and KPIs that they're tracking, and how they're changing over time. And so we walk you through some of those key concepts here in that section of model performance, tracking those clinical outcomes, governing, addressing issues as they come up, who's responsible for what, how do we escalate these issues up the chain of command, things like that. And also, this is all about scaling readiness, right? You're seeing how it's doing and you're understanding, okay, are we ready to take that next step and bring this to more people in our system or bring in a new tool on top of this other one? So this monitoring section is very important. It has a lot of really nice interactive content here and some great videos again from our partners at Vanderbilt University talking about algorithmovigilance, which is very similar to pharmacovigilance, the concept of pharmacovigilance, but in the health tech AI concept. Dr. Peter Emby was a great project partner on this and has been a really leading voice in this kind of topic area, calling for ultimately what he has termed the learning health system. And that really takes us then to the scale piece, which I was talking about a little bit earlier, but just, are we now expanding the use of this one tool that we have brought into our health system to more people? That's one way to scale. Or are we now seeing the success, seeing the success of this tool and bringing in an additional tool to supplement that, right? Or to do something else. And so we think about scaling in those two different ways. And this content will walk you through some of those key considerations, but tying us back to the learning health system concept, just being scale is not the end here. We want to circle back to that top of that framework and see, okay, we're monitoring and scaling these tools. We're seeing how they're performing, and thereby there will be improvements to be made. We do need to come back and plan and understand what's happening in these tools, plan how we're going to improve them, how we'll communicate that to our clinicians and our end users that rely on this transparency and trust in these tools to understand what's changing. And so we really want here to highlight the cyclical nature of this framework from plan to deploy to monitor to scale and ultimately back to plan. This is a very cyclical process of a learning health system, learning and changing and iterating on these tools. And so with that, I've probably, taken up a lot more airspace than was planned, but I am, happy to answer any questions that came through the chat, if any, or pass this back to Jake to kind of keep talking about some of the really cool work that we've done with Google for Health and our education courses.
Thanks, Ian. Yeah, no net new questions in
Cool.
the Q&A so far. We did get a couple responses to that initial survey question you asked about, and we're actually evenly distributed for folks who are excited, curious, uncertain, and concerned. We didn't plan that, I promise, but it just goes to show kind of the diverse perspectives we're bringing together here today in the audience, and really looking forward to everyone having access to these resources, kind of freely available, open access for folks to use. Ashley, go ahead.
Yeah, I did have a question. I've been very exposed to the playbook, but I still have questions. Um, as I was thinking about this, and as you were talking about monitoring of I was kind of wondering with the playbook, how are you going to, I guess, monitor the playbook or review and update the playbook? Because it seems like AI is moving so quickly and there's always something new. Like, what are the
Yeah.
plans to continuously modify that?
That's a great question. You'll see a little bit of that here at the end of the presentation today with
Okay,
some
great.
upcoming projects. But I think that's exactly it is, we're certainly aware that the guidance and resources that we create are, you know, the space is rapidly changing and a lot is changing. And so we do need to be spinning up new projects and updates. And so, Jake and I are actively working on thinking of how could we build out a better monitoring section of this playbook? What would that look like, right? And so we're certainly hearing from the audience and from end users of, hey, this is excellent. This is what we're thinking about next, right? Or these are some challenges that we're seeing now. And so having these types of conversations and these types of opportunities to engage with the ecosystem, the experts that are actually doing this is really valuable to us because then it can help us see where should we go next. So yes, there are plans to be updating and monitoring this playbook in certain ways. And I think it really falls into these next projects that we want to be running and kind of updating our AI umbrella, as we'll call it here at Dime.
That's great. Thanks.
Yeah, thanks, Ian. I think the call out is exactly right that we want to dig deeper into the themes or the areas that the community, our partners would find value, right? And so encourage everyone to, keep noodling as we go through the rest of our webinar today. Enter those in the Q&A. If there's anything you want to learn more about, we're very receptive to that. And that's what inspires us at Dime to bring together the stakeholders in the field to take that next step. If there's no other questions right now, I'm happy to shift gears and talk a little bit about our Digital Medicine Academy. Um, this does tie back to the playbook, so just give it 1 second. But the Digital Medicine Academy as a whole is an offering we have at Dime for both individuals and organizations. So whether you're an individual looking to grow your professional development or an organization looking to upskill your workforce, we do have coursework for you. And so you can access that here via the QR code on the screen. And we have more courses than just the AI initiatives we're going to discuss today. So if you're interested in virtual first care, if you're interested in more about sensor-based digital health technologies, please check that out. There's definitely more meat on the bone here. But Ian did mention some work we've done with Google for Health. It's been a great partnership. And so you can actually scan here and access and enroll in Google's Generative AI for Healthcare course, another free course that this one specifically is meant to demystify Gen AI and LLMs. And this is ideal for healthcare professionals, admin, medtech researchers, and innovators. And so, again, very specific to Gen AI and LLMs, but this was something we sent out with the survey and partnered with Google for Health to kind of share this free course. So, very excited to have been working with them on this in addition to the playbook. But what I want to chat about a little bit more as well is the two-part course series that we released the first part in September. The second course is actually coming next week. And the second course specifically ties to the playbook and heavily references the playbook. This course series was funded as a grant from the Patrick J. McGovern Foundation, so really appreciative of their support and what they've charged us to do, right? And what we set out to do together was to equip the healthcare workers in the low resource health systems to increase their knowledge and implementation skills when it comes to AI, because we recognize the unique barriers, but also the unique benefits of to AI in low resource health systems when we think about infrastructure, staffing, and access. And so it's a two-part course series titled Health AI for Low Resource Health Settings. The first course is Health AI Essentials, and this is truly a primer for aspiring champions. And what does it mean to be a champion? What we're saying here is that we want you to feel confident to be a part of or leading these conversations in your settings, to be able to participate and to confidently engage with and consider AI in your space. This course is really about that foundational literacy and knowledge. And so while it does have a low resource emphasis and a lot of low resource case examples, it is a great starting point for anyone looking to explore more about AI and specifically AI in healthcare. And that course is currently available free, 90 minutes, self-paced, and you can access that here on the Digital Medicine Academy site. The second course, which is coming next week, is Health AI Implementation. And so what we set out to achieve here was to lay out the practical roadmap for low resource settings to implement AI. And this ties very closely to the playbook. And when we go through the different lessons that are in course two in just a minute, you'll see how this ties back to those resources Ian expertly took us through a few minutes ago. This course series in general is ideal for clinicians, frontline staff, operations leaders, and community health workers. And I'd even add that executive administrative decision-making level for that second course when we really take everyone through identifying their problems all the way through implementing and scaling these solutions in pilots and phased rollout plans. So again, you can access both courses and enroll here through the QR code. And we'll bring this back up again at the end of our presentation. But would love to dig a little bit deeper into that first course and specifically what you can expect to find. There are 7 lessons, and it opens with this framing, this context of why AI, why now, why is this the moment, why is this the innovation that can have such a potential, particularly in low resource healthcare settings. Then we dig into what AI is, how it works, and where humans fit into all of this in very plain language so that it's accessible to all learners. We dig deeper into AI types and capabilities, specifically in healthcare. We talk about the data that underpins and supports these tools. And then we tie it all back to care in low resource settings because we know those unique considerations I previously mentioned. We do have a lesson dedicated to the ethical guardrails with AI, so bias, privacy, and really building and ensuring trust. And then I mentioned before what it means to be an AI champion. We really want you to come away from this course feeling confident and ready to participate or even lead these conversations in your setting so that we can really start to achieve and realize the value of AI responsibly used in healthcare. And I mentioned that we are really focused on plain language accessible learning here, but we also took a scenario-based learning approach. And so I'm excited to introduce the Hopewell Family Clinic. These characters are fictional, but hyper-realistic. And the way that we've pursued to help learners apply their knowledge in the real world. And so you can not just learn these concepts about AI or AI in healthcare, but see these use cases applied specifically to a low resource healthcare setting through Dr. Lisa Patel, our clinician and medical director at Hopewell, through Jonathan Ray as the director of operations, through a nurse practitioner, a community health worker, and the patients they serve. And these characters also serve as a bridge between the two courses. There's some additional characters in the second course, but again, it's just a really unique way to ground this information in reality, despite the kind of fictional scenario that we've spun together. So encourage everyone to check out and engage with the Hopewell Family Clinic in our course series. The second course, Health AI Implementation, is a 6-lesson course that, as I mentioned previously, is really this roadmap and ties really closely to the playbook's resources. Some of these terms and names of these lessons might sound familiar, right? We start with identifying the problems where AI can make a difference. And so you'll survey your system. You'll use that problems that matter exercise so that you can determine what are your pain points. Is it a problem amenable to technology? is it a problem amenable to AI? And then you can start to think about your intended use, your context of use, setting the tech capabilities necessary to proceed. And so then you move through evaluating and selecting the right AI tools with that AI fit checklist, that health AI evaluation guide. You strategize risk management. So we're thinking about setting success measures, talking about governance up front before we get into rolling out AI in these low resource settings. And in that rolling out AI lesson, you can expect to find more information on local validation methods. You can dig into pilot programs and what it takes to run a successful pilot, and even start to look forward to what are phased rollout plans and how can you consider those and set that expectation. Something we heard, and you might have seen this as a domain in the maturity model Ian reviewed, but something we heard from the project team and the community is that the adoption piece that's missing really does stem from change management. And there's not a lot of change management resources out there tailored to healthcare and to AI to really help with the people and the process side of this process. And so we have a whole lesson dedicated to engaging stakeholders in training through change management strategies, leaning on change management resources and principles from the ecosystem, just the Cotters of the world, but also from the World Health Organization and the resources they've put out for these low resource settings. And so really encourage everyone to check out not only the content about getting your pilot going and solving those problems, but also engaging the stakeholders, including patients and providers who are going to engage and interact and benefit from these tools. And then finally, we close out with a section on monitoring and auditing because we're looking ahead to scale or updating or retraining or decommissioning. None of those are a failure, but they're all part of the process and things you need to be aware of and prepared for in your implementation journey. And so I mentioned a number of times the crosswalks with the playbook. And so on the right here, I just tried to tie back to how the first three lessons really map closely to the plan section of that health AI deployment framework in the playbook. How lessons 4 and 5, you'll start to see the content from implement, and then of course lesson 6, we're thinking about monitoring and scaling. And so, just to reiterate, we do link out to along the way where you should expect to use and benefit from these resources. We link out to the problems that matter assessment from the playbook. We link out to the Health AI Implementation Survey, the AI Fit Checklist, the Health AI Readiness Assessment, the Health AI Evaluation Guide, the Build, Buy, or Partner Matrix, and the Maturity Model. So just encourage everyone who's having a good experience interacting with the playbook to consider enrolling in our two-part course series. The first course already available, the second course coming next week, and just really excited to have had the opportunity to work with Ian, to work with the project team, and of course to our funder, the Patrick J. McGovern Foundation. It was such a great experience putting these resources together and to make them freely available to the community. So um, I'll take any questions on the education stuff. Otherwise, I'm happy to pass it back to Ian um, to tell us more about some of the survey data we've mentioned a few times.
Yeah, Jake, it looks like there's one question here. Just how do you define or how do we define a low resource setting? It's a great question, actually. Something that we're probably grappling with as well, but would love to hear.
No, no, it's a great question. And so there's many different archetypes. And what we did before we set out to develop even the first course was we created a table internally. It doesn't appear in the course, but we wanted to map out the difference between rural and urban low resource settings, those federally qualified health centers and the community health centers that are in these different locations throughout the United States. We're thinking about frontier locations like Alaska or Native American populations as well. So we've been looking at it from that lens where low resource, while it is a bucket and something we set out to support, recognizing the unique considerations that go into tailoring these resources to not just one of those archetypes, but all of the low resource archetypes that we need to be supporting here in the United States. So hope that answers that question. It's a really good one, and encourage you to dig into the first course, into that supporting care in low resource settings lesson to learn more about how you can expect to shape that narrative. Go ahead, Ashley.
Yeah, I just wanted to chime in. I think the course is extremely valuable, even if you might not be at an institution that would be necessarily considered like a low resource institution. I know I recently took the course and I really like the emphasis on just like general like equity. And I think that a lot of those concepts carry through. And um, I definitely think it's extremely valuable, like no matter what kind of institution you're at. So I'd just like to plug that a little bit.
Yeah, I appreciate you saying that, Ashley. And yeah, just because there are those unique considerations for low resource settings, I think they are broadly applicable. And the most important thing is to come back to the foundational principles of the playbook of our course series that um, what we need to be doing is setting up the healthcare ecosystem to achieve the value and promise of AI, which is an intentional process. It's not just inherently going to happen because we start to use more AI tools. So, yeah, really excited to put this out there and to get that sort of feedback. Anything else on the education side? Otherwise, Ian, it's back to you.
Yeah, back to me. And speaking of great feedback and utilizing these resources, I wanted to highlight a little bit of the playbook in action at the University of Michigan. So Ashley and Dr. Gunbari were really excellent partners in this project. And they actually sent out our Health AI implementation survey that first, hey, assess, the landscape of your system, understand where people are feeling confident or curious or concerned about AI. How are they using it, right? They sent out the survey. Maybe some of you have seen it. Asking you all your feelings on this. And Jake, you mentioned earlier our survey responses, and they were all pretty across the board, right? Some uncertainty, some concerned, a little bit of curious, right? And I think that's very fair. And so, the early findings from this survey that was distributed at University of Michigan, where you found that, you're kind of in the early stages of AI adoption, as most people are, and you're expressing some uncertainty about AI, which most people are, I would say. Some of the staff limited or listed, some of these barriers to implementation right now are integration with existing systems and workflows, and lack of staff training. They also listed that the accessibility of some of the AI learning resources at UM may not be all that, readily available to them yet. So we're still kind of seeing some trouble with the accessibility here. And then 52% of you said that, you were uncertain about the outcomes are being tracked for AI tools. So I thought those are some interesting findings. But like I said, you all are not really alone in these sentiments. So Jake, we can go to the next slide. And as Jake mentioned earlier, we distributed at the beginning of this year a survey with Google for Health to over 2,000 stakeholders across 90 countries in the world. And they were really reflecting what the University of Michigan just showed us. Top barriers to using AI were training and integration. 40%, 7% of respondents rated insufficient training on tools and difficulty integrating them with their workflows as very significant barriers. Only 17% of people had been actually trained on how to use tools in their daily role. And then on top of that, a lot of them listed these concerns of lack of oversight leading to patient harm, disrupting clinical workflows. So a lot of people are concerned that AI could be making clinical errors that harm patients. And a lot of them, 54%, are, concerned of this lack of clear accountability for AI-driven errors. How are we governing? How are we monitoring these tools? And so really interesting to see the University of Michigan kind of on a local format, really reflecting a larger trend of these same issues that we're seeing. And I think it's something that, right, Dime is certainly working towards with helping to create these training and education resources, helping to formalize these governance and monitoring processes through the playbook. And so hopefully what you will see in the resources that we've shared today is kind of an address to some of these challenges, a response to some of these challenges that we built these resources specifically to address these types of issues that you're all experiencing. And so I thought it was really interesting to kind of make that tie and see just on a local level that it's not that much different from the larger trend. And I think that it's really important to note that. So with that, we wanted to, open the field to any questions that people want to have, or if we have questions or comments for ourselves, we can certainly fill the time. But open the floor if anybody has a question.
I will kick it off and hopefully we'll get some more questions in. But I did want to kind of chime in about the AI readiness service survey because I had not seen the broader results, and it is very telling that we are so in line with the rest of the world. I like that. And I did want to note to our community here that we are working on a way, some sort of documentation and a way to publicly share like our broader results. So stay tuned for that. We're working with Dime on that as well. And other things, so we have been working with Dime these past 8 months, and there's a lot of other things that we've been incorporating into our broader strategy for AI at the CVC. Obviously, given those results, we are really working on more education for our community, working on some additional webinars, some workshops. We are hoping to implement some AI champions of our own and at the CVC. We've also used the maturity model from the playbook in helping us with our scoring rubric for our new innovation AI track. So we're using some of that language to help ourselves evaluate our internal projects here as well. So we are really using a lot of these tools. I think they're very helpful, and I definitely encourage everyone else to take a look and use them as well. So I just wanted to mention that really quickly before we get other questions.
That's fantastic, Ashley. And as we're waiting for other questions or anything, something that was that popped in my head, Jake, you were mentioning patient engagement as being, and it wasn't something that I necessarily dove into in the playbook, but I think it's something very important to highlight here. And we have a lot of resources in the playbook itself from patient advocates. But there's a lot of interesting, conversations happening right now about how patients are using AI and how that fits within care and the relationship between patients and caregivers and clinicians and health systems. And so I just wanted to bring a little voice back to that here and just say that, this patient and community engagement piece is so, so important, especially with these tools where we're relying on large data sets and can see, discrepancies in how different people are responding to treatments or how these tools are working differently for different populations, like the pediatric example I gave earlier. So it is just so important to be asking clinicians who are using these tools, how's it going? It's so important to be involving patients who are the end users or being touched by these tools. What are your expectations and how is this fitting into your care? And are you getting the information that you expect to be getting out of these tools or from these readouts? So there's a huge component here to that community engagement that I just didn't want to forget to really hit on here that I probably missed in the demo a little bit.
We got two questions here, Ian, if you want to dig in.
Hmm.
So the first being, where should the AI implementation playbook be used? Like specifically at the University of Michigan, for example, there's multiple different departments who all deal with AI in healthcare. So can you give voice to kind of, you talked about the stakeholders at the beginning, but maybe kind of your vision when developing the playbook or what you heard from partners?
Yeah, it's a really good question, and I think it's a reflection too of the time that we're in. And these are certainly conversations that we have internally at Dime about how are we doing this. But who owns the overall AI agenda, right? I think we are calling for there to be a central place within your system that does at some level own that entire process. I know partners that we've worked with at Vanderbilt University who are very much along in their maturity. They have a dedicated, department, a dedicated person who every tool goes through them, from that procurement piece. Every tool is included in their monitoring framework. And so it is across departments, it's across their medical school that they have, essentially one person or one kind of function owning all of these pieces. I recognize, though, and we recognize that not everybody is along that same level of maturity. And so I think that, and Jake, please feel free to chime in here, it always comes back to people, the processes here, right? You have to have that strong line of communication and collaboration. You have to have a line of insight into what the other department is doing, how they're using it, and have to be able to communicate that with each other. And so I think it really circles around having an open line of communication, having visibility into how you all are implementing these tools. And working towards a goal of finding a centralized space or opportunity to be tracking and kind of owning all of these implementations at once.
And I can kind of chime in on behalf of like the University of Michigan's perspective. Um,
Yeah.
as the comment noted, we have a lot of different departments all working on very similar but slightly different initiatives in terms of AI. And so CVC Innovation Program is working on one of our big initiatives is trying to communicate and help connect people to all these different initiatives. Who are the experts in what area, um, and so we are, Doctors Gambari and Figueroa are really leading that effort to kind of benchmark and build those relationships and bridge that communication. And so we are working on that. I know that at the University of Michigan, there is not necessarily a centralized AI place at the moment. I can't speak broadly what the university's big plans are, but I'm sure there's probably discussions heading in that direction of how to manage this a little bit more broadly. But if you are interested in talking more about that, Doctors Gambari and Figueroa, I'm sure would love to have more conversations along those lines.
And something that just popped in my head and what we've been hearing a lot from partners as we were developing this was, it's not necessarily it's not bad that you don't have this centralized place yet, right? Like we're all learning, and I think one of the really important lessons that we have from the playbook was for clinicians and these frontline people to not be afraid of playing and using with these tools and testing them out. So this curiosity of, hey, this department is exploring this tool and we're using this one over here and we don't, I think there's a level of that that's really good and beneficial and, giving the clinicians and those frontline folks some real autonomy and confidence and hey, yeah, I can use this tool. I know what to expect. So it's really cool that there's so much curiosity and there are people using, AI and bringing it in. And I think it lends itself naturally to a good process to pull it all together eventually. But that curiosity is great, and you really want to capitalize on that with, your staff.
Yeah, and just to give voice to the low resource angle to all of that, when you don't have the resources to dedicate to a centralized AI, even just like overarching strategy, because there's so many other priorities right now. That's why we really focused our first course on supporting AI champions, because the more we can equip everyone with that foundational knowledge and the confidence to participate or even lead these conversations, that's a great starting point that everyone can benefit from. We've got one more question here we should try to dig into, Ian, before the top of the
Yeah,
hour.
it's a tough one.
This is a tough one it's about workflows. And so kind of redesigning workflows for AI or integrating AI into existing workflows. And what comes to my mind initially is that some of these tools introduce new, whether it's like you're recording a conversation now because of an ambient scribe, or you've now got an alert system that, sure, you can try to get that alert in the EHR where you're already documenting or working, but that alert system is net new. The documentation being recorded requires you to start and stop, even for example. So while we're intending to integrate it into the workflow where we're trying to encourage, not having to leave the screen or the window or the program to go access these tools. I think realistically, it's going to be different for every different type of use case for predictive versus generative AI, but we're going to see just new parts of these processes regardless. But the emphasis being to try to take lessons from the transition we made to EHRs, for example, where when the emphasis wasn't placed on human-centered design and really helping clinicians own that process, we start to see things break down when you're adding clicks or you're adding time where it's supposed to be saved or simplified. And so I think that's where we try to go with our education courses. And what we advocate for in the playbook is to really thinking about not reinventing the wheel, but you have to recognize what is novel and new. But Ian, anything you want to add to that before we close out?
No, I think you hit it right on the head there. Yeah, nothing to add.
All right.
So,
Other than that, I would just say that even if you design the workflow or integrate it into a workflow, it's constantly evolving, like Ian said, and you're probably going to have to revisit that along the way, whether it's changing a note template or kind of just seeing how things are operating with missed alerts, depends on the type of application.
the sheer power and data that's behind all of these tools, I think we will start to see a need for some redesign of workflows. We can't expect the old system to fit these new tools. But so we're really in this opportunity now of defining what do changes look like or what don't they look like. So yeah, great voiceover, Jake. With these last few minutes, we just wanted to tie this all back to a few upcoming opportunities for our community to get involved, shine a light on some of the projects that Dime is continuing to lead. So we have an upcoming project scaling trusted high impact AI care navigation and coordination. So healthcare navigation is exhausting and costly for patients. It's very complex for clinicians and the coordination side of things. And so we are developing a project to unite leaders to scale trustworthy AI guided care navigation with built-in trust, equity, and ROI. This is a great opportunity for, this ecosystem. Anybody, we're always looking for key opinion leaders, subject matter experts to lend their insights to these projects or new partners to come on board. So very much encourage our audience to scan the QR code and please try to learn more about this project or reach out to us if you have any questions. We'd be happy to point you in the right direction.
All right. And before we close out, I'll make one more kind of plug here to scan the code. Go to the Digital Medicine Academy. You can enroll today in the first course, and next week we'll have access for free on the same webpage to the second course as well. And so, really, just encouraging you all to get involved, learn, and then at the end of the course, both courses, you'll have the opportunity to share feedback, and we really benefit from that as a Dime community, and look forward to continuing to help support workforce development through these types of initiatives. So. Thank you so much, Ian, for having me along today, and for Ashley for bringing us together. This was great.
Thank you both. I feel like I learned so much. I think everyone else did as well. I really appreciate it. And I will follow up with the recording and some useful links to those who were on the call. So thanks again.
All right. Thank you all so much. Have a great rest of your day.
Bye.
Cheers.